All right, so let's go ahead and move forward. So today we're going to just do walk through a little bit about what is equity, why it's important to us in this work that we're doing, how to create internal equity readiness. Then we'll have a brief pause for questions and answers before we go into how to incorporate equity into safe routes to park stages. And then we'll have another time for some questions and answers. So there's going to be a lot of information today. We will definitely share the slides as well as the recording after, that you can share this information with your partners or rewatch it again or look through the slides because it is a lot of information. So I'll do my best to present it slow enough so that you can retain it and then also have time to ask some questions during the Q&A portions. So right now, just for welcome and introductions, if you could take some time in the chat box and put your name and what community you're with, and if you are outside of the nonprofit that received the funding, tell us how you are partnering with the particular nonprofit on this effort. So one more time, make sure you use the chat box, share your name, where what community you're from, and then what if you are a partner of the nonprofit that received the grant, share your supporting role, like public health or transportation. So go ahead and put that in the chat box, and also feel free to put your questions and any comments that you have in the chat box. And Marisa Jones, who you met last time virtually, she will be able to assist us in the chat box. All right, so before we get started with everything, I wanted to ground us in this Equity Manifesto, which is from Policy Link that some of you may have heard about. It's a National Research and Action Institute, Action Institute, Advancing Racial and Economic Equity. So it begins by joining together, believing in the potency of inclusion, and building from a common bond. It embraces complexity as a cause for collaboration, accepting that our fates are inextricable. It recognizes local leaders as national leaders, nurturing the wisdom and creativity within every community as essential to solving the nation's problems. It demands honesty and forthrightness, calling out racism and oppression, both overt and systemic. It strives for the power to realize our goals while summoning the grace to sustain them. It requires that we understand the past without being trapped in it, embrace the present without being constrained by it, and look to the future, guided by the hopes and courage of those who have fought before and behind us. This is equity, just and fair inclusion into a society in which all can participate, prosper, and reach their full potential, unlocking the promise of the nation by unleashing the promise in us all. And I'm going to say that one more time. This is equity, just and fair inclusion into a society in which all can participate, prosper, and reach their full potential, unlocking the promise of the nation by unleashing the promise in each one of us, in all of us. So that just goes to show that everyone who's on today's call, everyone that's a part of your organizations that you work with and collaborate with, all have a role in this equity piece. It's not one person, it's not one organization, but it's each of us. We play a role in improving equity and improving the inequities that exist in this world. All right, so we just talked about this is equity, but can we define what equity is? So you'll see a lot of definitions and diagrams about it. And so the one that we chose for you all today is this one from Robert Wood Johnson Foundation. And so it shows the difference between equality and equity, which is sometimes confused by some folks, that there is a clear difference between equality and equity. As you can see with equality, everyone here has the same bike. And because everyone has the same bike, there are also different abilities. And so not everyone can use the bike to be active or to get to a certain destination. Whereas when we look at equity here, you can see that you have the bikes are tailored to the needs of the individual. And so everyone can use it to be active or to use it for just active transportation. And as you can see here, we have two definitions, one from the World Health Organization that says the absence of avoidable or remedial differences among groups of people, whether those groups are defined socially, economically, demographically, or geographically. And that's something to note when we talk about equity. We're not only talking about racial equity. We are talking about inequities in income, education, the geography. There's just different inequities that exist. And so when someone is not able to live to their fullest potential, we really want to work towards doing so. All right. And so racial equity may come up often because race is a huge predictor of someone's health. And so it affects not only health, but education, the criminal justice system. It really lays across various systems, but here we are talking about equity in a variety of ways. And then a blogger, Vule, if I'm saying that correctly, he says equity is about ensuring the communities most affected by injustice get the most money to lead in the fight to address the injustice. And if that means we break the rules to make that happen, then that's what we do. And that's how I thought that was a great quote to kind of to get to it, because a lot of the systems that are built up as we see it have to be adjusted, have to be changed in order to really support those that need it the most. So that's what we have to do in our work. That's what we have to do. Not breaking any laws, but just saying we need to help to adjust the systems to really support those that need the most support. Okay. So achieving equity, when we think about achieving equity, there are these, 4 things we want to think about. We want to make sure that we're paying attention to the root causes of these inequities and disparities. So what is at the root of there being limited access to parks in your community? Also paying particular attention to groups that have experienced major obstacles associated with socioeconomic disadvantages and historical and contemporary injustices. When we're just talking about equality compared to equity, we want to pay attention to everyone. We're not trying to leave anyone out when we talk about achieving equity, but because we are at a disadvantage looking at certain communities, we want to make sure that we're paying closer attention to them to get their health and their wellness and all the other systems where they're at a better level so that they can be and live in their fullest potential. And when we get everyone at the same playing field, if that were to occur, then we can really talk about equality from there. And maybe even at that point, we still can't, because we have to really continue to give folks the resources that they need to support them in their development. Promotion of equal opportunities for all people to live healthy lives. We definitely still want to think about promotion of equal opportunities, but again, making sure we still pay particular attention to groups that have experienced major obstacles and making sure that they're getting the resources that they need. And then distribution of economic resources in a manner that is intentionally reduces disparities and improves opportunities for all. So we'll talk about some examples of that later, but really we have to kind of put our money at the forefront of this. It's not only about creating certain strategies, but what funding can we put behind these efforts to really move it forward so that we can help to reduce these disparities and really improve opportunities for all. So why do we think equity is important? We're only going to talk about 2 related to today, and it's going to be focused on health inequities and transportation inequities. And so with health inequities, there are a lot of health inequities, as you can see, but just want to point out to you on the left-hand side of the screen, you'll see Latino health disparities, and on the right-hand side, you'll see African-American health disparities. And so these are also compared to non-Hispanic whites. So asthma as you can see, for Latino and African Americans, are 2 times more likely to have asthma than non-Hispanic whites. When we look at diabetes, 65% for Latinos, 60% more likely to be diabetic than their white counterparts. Obesity, 15% for Latino health disparities, and then 40% for African Americans in terms of more likely to be obese than their non-Hispanic white counterparts. Now, when we look at the children, asthma, same thing, 2 times higher for both sides, for Latino and African Americans compared to their white counterparts. And then obesity, as you can see, 35% for Latinos and then 73% for African American children. So as we're looking at this is just going back to what we were talking about in the beginning of just things that are just laid out just unfair. Like we shouldn't have a whole group of a population suffering in this manner, especially when there are things that can be done. There are ways that we can prevent this. It's not easy, but there are steps we can take. So transportation inequities, just some examples here on the left-hand side of the screen. You'll see for income, people killed while walking. If they were lower income, they were twice as likely to be killed while walking compared to higher income individuals. Those that were African American and Latinos were twice as likely than their white counterparts to be killed while walking. Also, as you can see here with the bicycling, those that were killed, 30% more likely and 23% more likely than their white counterparts to be killed while bicycling. All right, and then in terms of the physical environment for walking, 90% of high-income communities had sidewalks, and 49% of low-income communities had sidewalks. So that's a huge disparity there. I wonder why. All right, so how prepared, when you think about you, yourself, and your organization, how prepared are you to really start to execute some type of strategy to address, or strategies or a strategic plan to address equity? But this will just take you through a little bit of things to consider. There's this, we worked with We Collab last year, an organization, and they really helped us really think about internal equity readiness. And so this is an equity readiness continuum. And as you can see, the continuum means ongoing. And many times when we think about our work in equity, we're ready to jump to the external work. We're, okay, like, what can we do? I'm ready to get out and get working. But a lot of the work, as you can see from this continuum, starts internally. So what assessment are you doing? Looking at your own policies, your own practices around equity. And then what type of training or technical assistance are you taking part in to understand equity more, to learn a little bit about it, learn about how to create strategies or even your own definitions around it for your organization before you're moving into creating any strategies internally, as well as strategies that you would want to use on your external work. And then implementation, and then you get to your external commitment. So a lot of the work happens even before you express this external commitment for equity. And it's a continuum. So you may be like, you've had your commitment, this is your external commitment, and as you learn more, you might come back and say, I need to go back and look at some of our strategies. We need to look at some of them as we've learned more. And we need to continue to do some training and technical assistance around equity. That should be ongoing. So you'll never really be done. And that's the good thing about it. They're really no true experts in equity. So these are some questions that you can ask yourself and your organization. And again, these slides will be available, so you can take them and sit down with your organization, sit down with your coalition, your Safe House to Parks coalition, and see, where you all fit, what things do you want to work on. So here, number one, does your organization have an internal definition of equity? It sounds very easy, but it could be very challenging to develop one. So that's a really good place to start, having your own health equity values. Then also, have you created a team or hired staff that have relevant experience, whether lived or professional, that really align with that target population that you focus or you work with often? Then looking at your partners, can they really move that equity agenda forward as well, based upon their experience, their lived or professional experience? And then what internal policies and statements has your organization made to articulate that equity strategies that you've taken or want to undertake? Also thinking about who within your organization or your team is really responsible for leading the charge of equity. And do they have support from leadership? Because we know often that this work cannot be done if everyone in the organization doesn't see the value in it and can really move it forward. And the leadership really has to be part of this so they can really help direct the path. Number 6, have senior leaders and or board members been briefed and they have an opportunity to contribute to the equity strategy? Yes, it could be really developed from the core of the group, but how are folks able to, or how are the leaders being a part of this conversation? How are they contributing it to the conversation of the equity strategy? That's important as well, because that will also help with their ownership, and you just need different perspectives. And then number 7, what type of training is in place that really allows your team members or staff to embrace new equity strategies? Like we mentioned in the Equity Continuum, Readiness Continuum, making sure that training and technical assistance is a part of that learning before we get to that external commitment. And then last, does your organization have defined outcome metrics to understand your equity impact? So it could be, noting the number of hired staff that have relevant experience aligned with your target population. It could be the number of internal policies or practices that you've established. It could be the number of training opportunities that you all have undertaken so far. So just having various ways of saying, just like we evaluate everything else that we do, we want to make sure we evaluate the impact of our equity work as well, internally, and then as we're building up what we're doing externally. So lastly, before we leave this section and a brief time for some Q&A, just the 4 actions that you can really just take now. So you can review your mission, your vision, and objectives of your organization and the project to really ensure equity is in alignment. I think that's pretty straightforward. Making sure to develop, like I just mentioned, develop metrics or benchmarks to really measure equity impact or equity activities. And there's some, I think it's healthequityguide.org that has a lot of case examples of some health departments and other organizations that have done work around this. So that's a really good resource. And I could send some of this information out later. But healthequityguide.org is one that I look at often. And then the Government Alliance on Racial Equity as well, GARE. Third, research the history and current day intersectional issues that impact the neighborhood in which your project is being implemented. So that's really important before you're entering a community, really even before you're starting a project. Do you even understand the community context? Do you understand the historical context in the current day? What are the intersectional issues? It's not only race when we talk about equity, like I mentioned. So gender, race, income, how are all those playing out within your community, especially related to the particular topic that we're talking about in terms of access, safe and equitable access to parks? What does that look like for an African-American woman, low-income woman, compared to someone else? And then lastly, review your list of partners to ensure there is representation of community members and relevant intersectional topics. You want to make sure that the partners that you're working with represent the population that you're focused on. and the various topics, like I just mentioned, like gender, race, and income, making sure that that is represented as well. It's really important to see for people to have representation, especially when we're talking about planning and you want to get folks engaged in work. Having representation it goes a long way, trust me. So I'm going to stop here and see if there are any questions for, like, what is equity? Why is it important? And then thinking about ways to get ready internally. And I just want to note before I open it up is don't allow, I don't want to say don't allow, but I don't want you all to be stopped and saying, we can't really move forward until we've done like all this work. There's some things that you can do, even if it's like we mentioned, having a definition and some values around equity. And then start just doing some, there are webinars on equity that you can look into. There are some things that you can do. So I don't want this to limit anyone. These are just some things to consider on your route. And we'll be providing in the next section some specific things that you can do, some concrete examples or steps you could take to incorporate equity into Safe Routes to Parks. Nanette, I see that you asked to be the presenter.
Hey, Danielle, it's Marisa. I responded via chat. That is an auto thing that pops up if you click a certain button.
Oh, okay. Thank you. All right. Any other? And we'll have time for more questions at the end. Is there any group or any organization on here who is like, I'm just not at all ready, or want to share some of your own challenges about, being ready or getting ready to do this work? Feel free to chat it or unmute yourself and share. Or any organization that's like, I'm ready. I'm ready for the challenge, ready to get started. Yes. I'm guessing yes, Landis, is yes, you're ready for the challenge. Okay, Bike Durham is excited about the challenge. Great. But we're a mostly white group and we are struggling to gain representation. That's definitely understandable. And we'll have to talk with Hey Ty a little bit more about this. Ways to reach out and gain more representation, because that is key. And we will talk more about a little bit about that, some questions to ask shortly. Great. I'm glad to hear that, Kenyon. And we'll talk tomorrow. All right. Please feel free to keep sharing through the chat box. Would someone like to say something before we move on? Race, language, different guidance for different aspects. I don't know that off the top of my head. Typically, like the one I was mentioning before about the GARE, Government Alliance on Racial Equity, that's more obviously focused on racial equity. But the Health Equity Guide.org is broader health equity aspects, but I don't think it goes, well, yeah, I think they do mention some things about language and income, but that would be the only one. But I can look into that more. That's a good question, Laura. I will look into that. Sources. All right. Keep them coming, please. All right, so we're going to go ahead and move on to the second portion. I tend to speak really fast, I think, so I'm telling my head to slow down because I know it's a lot of information. Okay. So now we're going to go into how to incorporate equity into safe routes to parks. So just to remind those who may not have been on the group orientation, the framework is assess, plan, implement, sustain, and then in the mix of that is engage. And so engagement is its own stage, but then it's also within each one of the other stages. All right, and so we're going to talk about incorporating equity into each one of those stages. All right, so the first one is engagement. So how to incorporate equity into engagement. And so when we think about engagement, there are two pieces, but first we're going to talk about the broader community collaborations, and then there's the partner coalition. So you all have been hearing, if you've had some of our one-on-one meetings so far, or even from the group orientation, you've heard about needing to develop or work with an existing partner coalition. And so that coalition has a variety of partners, including residents. But this, when we're talking about community collaborations, is the broader, like reaching out to other residents outside of your partner coalition. So we want to make sure that we're engaging and forming authentic relationships with residents, including youth, which are very key, especially when we're talking about safe routes to parks, that live within the neighborhood and that represent underrepresented or high need populations or groups. And what's key here is authentic relationships, which tend to take a lot of time. If you just think about your own personal relationships or professional relationships, when you could tell a fake relationship compared to a more authentic relationship. And when you think of your more authentic relationship, that is built over time. It's built through trust. It's built through working together. So just noting that it won't grow right away, but it will grow the more and more you can build trust and work together. And so a way to do that, and we want to make sure, is to have you all make sure that you're including residents most impacted by this work in decision-making opportunities as much as you can. Some of you may have seen the spectrum before. It was adapted from the International Association for Public Participation. On the left-hand side, so as you're going to the right, you'll see more increasing impact on decision-making and implementation in terms of the residents. So on the left-hand side is typically what we see when we talk about community engagement. So folks going in and really informing the community about what they're about to do. When you look all the way to the right, empowering is where residents are really leading the decision-making. And you tend to see more ownership on that side. At the bottom, you'll see an arrow says power over, power with, and power to. That we'll talk about in a minute, but I just want you to note where the power over really falls around the informing, consulting, involving-ish, and then the power with, power to is more on the right side. So when we think about an engagement, it's obviously more robust, like I mentioned on the right side of the diagram. This is also can be read as the spectrum between buy-in and ownership. So on the left side, we are often mobilizing people to support or provide limited input or feedback to our decisions. But on the right side, we're organizing people to identify their interests and assets. They become more of deciders, outcome producers, more like advocates, and like our local leaders that we mentioned wanting to be national leaders. It's about shifting power to the community. So it's not always necessary, appropriate, or within your capacity, really, to practice collaborative or empowering. So we're not saying if you're informing or consulting to jump there. We're just saying move along the continuum as you really are able to. And so, because we know it's not always within your power, but you should really try to push yourself, push your comfort, push your assumptions to really move farther to the right. Moving to the right really means giving up some power, because this work is really not about our power, but really about the community's results. It's essential that wherever you kind of fall on the spectrum, that you are clear and really transparent about your position, and fulfill that promise that you made. Don't promise a more involved, collaborative, or empowering level of engagement, but then deliver a more informing or consulting level. Just be real, be transparent. So if you aspire to more engagement, communicate that and take clear steps that demonstrate your commitment is real. It's also important to be transparent about how much power you're willing to give away or not. And that's okay. So the follow-up on the community engagement spectrum, these are some questions that you may want to go through with your coalition, or if you have an existing one that's kind of separate, speak to your different stakeholders about this. These are here to really help you move through that continuum of creating authentic community engagement. So you might want to ask yourself, like, where am I now? Where are we now? Where do we want to be? And even if that's from insulting to consulting. What steps will you need to take to pursue the level of engagement that you aspire? What power or control do you have to give up or share? Thinking about what expectations you'll need to communicate and fulfill for community members. And then what work will you need to slow down or trade off in order so that you can advance community engagement. And the good thing about Safe Routes to Parks is that, with the framework we have, engagement is through every stage. So you'll never be able to check that box and say, I'm done. It's going to be throughout. We're always going to be bringing it up, because that really is equity. When you engage communities authentically, that is one way, a huge way of addressing equity, really working towards improving equitable access. Then how do you ensure that your community engagement is advancing your results? So you want to make sure you're checking in, whether it's surveys or doing focus groups or quick one-on-one interviews with residents, saying how you're doing in that work, so you know how to do better in the future. All right, so power dynamics. I mentioned on this slide at the bottom the arrow. So informing, consulting, falling more on the power over, collaborating, empowering, falling more on the power with, power to side. So we're going to go over some of the expressions of power here. And like on the previous slide, I did mention that question about what power or control do you have to give up or share. So power dynamics are really inherent to any organization and how it functions internally. For example, organizational practices and operations, and hereby how it functions and works externally with partners, including how it works with residents. So like we mentioned at the beginning of this training, really working on internal equity readiness can help to make processes more diverse, inclusive, and equitable, which can help to change the organizational culture and how an organization is working externally with partners, especially residents with different demographics. So what we really want you to receive from this slide in particular are the expressions of power. So that something to note that the extent of power of an individual or a group is really correlated to how many different kinds of resources they can access and control. So if we are truly saying that we're working to improve equitable access to parks, or whether it's parks or another material, human, intellectual, and financial resources, there's anything else, there's a level of power that should be shared with community residents, whether that's from your organization or your partners like transportation or public health. And like we mentioned before, just knowing what level of power you're willing to give up or share or totally turn over. That's fine. But being very real and transparent about that. So the first expression of power we have here is power over. This is the most commonly recognized form of power. It has many negative associations for people, such as repression, force, coercion, discrimination, corruption, and abuse. Power is really seen as a win-lose kind of relationship. And having power involves taking it from someone else and then using it to dominate and prevent others from gaining it. And this is knowingly or unknowingly. Often people say, I mean, a lot of us on this phone call have powers in our own rights. And, you know, sometimes it's like, but I'm not dominating over resources, but it could be even unknowingly. So we'll talk about some of that later. So just, you know, just being cognizant of the power over is more so, you know, we're controlling these resources, we're controlling the decision making, and that's where the informing and consulting really fall on the community engagement spectrum. Then as we're moving over power with, that's based on more mutual support, solidarity, and collaboration. So power with really multiplies individual talents and knowledge. So power with can really help build bridges across different interests to transform and reduce social conflict and really promote equitable relations. The third one is power to. That one is where you see citizen education and leadership development happening for advocacy. And that's really based on the belief that each individual has the power to make a difference. When we were saying that local leaders are national leaders, giving them the tools that they need to live their fullest potential, that's what we see as power too. And then that helps with sustainability as well. And then the last one, power within, is often, we not really think about it, but it has a huge impact. Because even if you're working with residents and you're really sharing power and you're giving power, but if the residents, you know, that person doesn't really feel power within, you might not be moving. They might not be moving in the direction you really want them to live in their full potential. So many grassroots efforts use individual storytelling and reflection to help people really affirm their personal worth and recognize their power to and power within. And I know I was having a conversation with Hayti yesterday, and they use storytelling, and it's a really good way for individuals to really, you know, understand their worth, where they came from, what their ancestors have gone through, and really help to light a fire. So really, ultimately, when you think about expressions of power, it really does impact equitable access and control of resources. So it's something that we really want to think about and be honest with, and work as much as we can to just work towards giving more and more power to residents, and having them really lead. Our role is really just to support them. We are definitely needed. We will never be without a job because we have certain expertise areas, but that's okay to share certain things, you know, and sharing, you know, skills and knowledge to build up residents to be able to do different things. And then, you know, us working together and moving the work forward as much as we can. All right, so this was the other part I was talking about with our partner coalitions. So we had the broader community collaborations. Now we're talking about just our partner coalitions. So when you're developing or engaging your coalition, you just want to think about your partners that, you know, do you have organizations that really represent or include those from underrepresented or high need populations? Do you have anyone that's currently working on park access with that neighborhood focus? Any organizations that serve that specific geographic neighborhood, and those that are most trusted by the community residents of that specific neighborhood that you're focusing on. And we'll delve deeper right now. So who's coming over to your dinner? Who's going to be at your coalition table? These are some questions that you can think about in terms of who is on your coalition. So do you have someone that has been directly impacted by lack of access to parks on your coalition? Thinking about demographically, how many people on your team demographically reflect the population that you're serving? If you have a large Native American population, is there anyone on your coalition that represents that population? how many people work directly or indirectly with that target population, and then how many people on your team have grew up or even live in that neighborhood. That's why it's so important to have residents that are part of your population that you're working with on your team. They will know it better than you will. And like we talked about before, having some community context, you are getting that specifically from your residents that are on your coalition. You know, that something that you may not have yourself if you didn't grow up in that community or live in that community. All right. So understanding who is really on your coalition in these ways that you see listed here can really help you identify what strengths and gaps you have in terms of experience and content expertise about the intended beneficiaries and the issues in the neighborhoods you serve. And the majority of your team, if the majority of your team is not really captured here, you need to really address equity at your table. And you really need for community engagement, and it's more acute to really take some time and look at this. I mean, if you can't get every piece of it, that's fine, but we're just asking in this is just to move forward, some way that you're moving forward. All right, so some of you may have heard these fundamentals before when we talk about community engagement. Making sure you have meeting times that work for residents, meeting locations as well, venues. You want to make sure that folks feel comfortable coming to a place. They may not want to come to a government facility. Also thinking about the format, the content of communication and publicity materials. Is it in the language that that population speaks? Is it in a format that they would really like? Is it a whole bunch of writing, you know, or is it more pictures? Are the pictures representative of the population? Also thinking about the meeting format. You want there to be sharing. It shouldn't only be, like we mentioned, informing. It should be where, yes, you're sharing information, but then you're also giving time back at each meeting to hear from the community residents. They really should be leading it as much as possible, but at least giving time for them to share their voices. You want to be able to hear their voices. And then making sure that you are thinking about accommodations, because you may have all those things listed above, and then it's like, but I still can't get there. There are these other things that are priorities for me that I just can't get there. So addressing transportation, having food, childcare, translation, signers at your meetings. And knowing that I actually sent this morning out to the leads of the grantee groups that the program guidance on how you can use the funding, just some examples. And so we did mention that you can use the funding for those accommodations there, as long as they are helping you to develop your action plan and implement your early action. All right, just pausing because we're about to move on to assessment. All right, so with assessment now, this is, where you're obviously assessing the state of the community. You could do walk audits here, collect some crime data, some crash data, doing some qualitative data collection where you're doing focus groups or interviews. And in this, you really can involve residents, including youth, in these activities. Also, like I mentioned before, understanding the community's context, for example, their history, as well as current day topics that really overlap. And I just want to share about, so when we were working last year, Marisa and I were working with the Portland grantee Verde. And so we did a article for them that was going to appear in Portland, obviously. And so we mentioned the term addressing blighted properties and dumping. And then we had, obviously, before we sent it out, we had Verde review it. And Verde was like, well, can you change that, change that word blighted to disinvested? And they shared because, blighted was historically used by the Portland Development Commission to justify the displacement of Black residents from their blighted, exclamation point marks that you can't see, homes in the Albina neighborhood for the sake of building the Highway I-5 and the Emmanuel Hospital. So that's history we wouldn't know if we didn't work with, that particular, group of folks. It's always important to know, because you could start off bad and you don't even know it. You can go in bad. So it's always important to understand the community's context, the history, certain things that, were done to a community, or things that currently are being done that really you just want to be aware of. It's just important to have that understanding before going in. Making sure to collect and analyze data to account for various types of diversity within a community, so including qualitative data about community perceptions of park access is important. So meet with local residents to really hear their stories about the history of the neighborhood and park, listen to why people feel unsafe walking to the park or aren't using the park at all. That's also very important to take note of. Also listen out and ask about the great things about the neighborhood that they like. So we don't always want to focus on the negative. It's also important to hear the assets of the community that we can build on. And then lastly, conducting a policy scan of transportation and park policies and or practices that are related to safe routes to parks. For example, as you can see listed here, comprehensive plans, Vision Zero, your parks and recreation plans, a complete streets policies, and see how those may negatively, like if they have any negative effects on low income and communities of color. So that means that you would review it and see if there are any unintentional negative consequences for low income and communities of color. All right. And so an example for incorporating equity into assessment from our last year grantee, Candy Houston, they really did a good job of working with their residents and training them. So they did a community leadership and advocacy program with their residents. So to give them the basic knowledge about the topic and basic data and analysis skills, very basic. And so then they were able to go out and have the residents select which parks they wanted to focus on. And, to their surprise, they actually added on a park because the residents were like, no, this is a park that we actually would love to use, so that's something they didn't know. And so they also the residents led the Safe Routes to Parks walk audits at each of the parks. And they helped to develop a survey to understand the barriers to accessing the parks and potential solutions to overcome those challenges. And so with that survey, they were able to capture information on safety, quality, various features, and access to the parks. And the survey occurred in conjunction with the walk audit. And for those that couldn't make the walk audit, they had them available to collect that information. And so after that, Can Do, like I mentioned before, through the leadership development opportunity, they went and they were able to analyze that data, very brief analysis. It wasn't anything like SAS or SPSF, any of that, and really just saw what rose to the top as the priorities. And so they identified reducing driver speeds, lack of crosswalks, fixing cracked sidewalks, adding signage and streetlights, and removing a fence that really serves as a physical barrier to the actual park. So just again, showing you that involving residents is really key to this work. Again, it really helps with ownership and gives you perspectives that you would not have, you would not know yourself, especially if you don't live in the community or have never lived in the community. All right, so planning. This is our third, right? Third stage out of the 5, incorporating equity into planning. So first off, we want to make sure, we just left the assessment stage where we collected our quantitative and qualitative data. We want to make sure we're using that data to really drive the priorities. We're not just collecting that data just to collect it. It should help to inform our priorities and investments. And it's really key. We find that if you're working with transportation folks or just anyone, if people want to know what the community says. They don't want to just do what like our own organizations want. They want to do what the community wants. So making sure that the data really drives those investments and those priorities, and that we're making sure that we have lived experiences really holding up as strong, if not stronger, than quantitative data. Then developing targeted policies and solutions for communities that need the most support, developing strategy and making sure the strategies really help to minimize the negative impacts of planned efforts. So, we want to look at creating, or you want to create and or review and update existing policies, plans, and programs that you might have to work with, like your transportation stakeholders on these, or schools, if it's like a safe routes to school travel plan. But you want to look at those policies and look for specific language that really directs investments for safe access to parks to communities that need the most support, and being mindful of unintended consequences that policy changes may have on existing parks in historically disinvested communities. A lot of times it's not like an intentional thing. We don't think that, we're not creating these policies and saying, oh yes, we want to purposely hurt a community. But sometimes we have to step back and think, okay, how is this change impacting marginalized communities? For example, like if there are changes in policies are really not supported by funding, like some parks may not be able to meet the new requirements and may face consequences such as closure. So you want to just make sure you're thinking about certain things, that you're putting certain things in place and saying this park needs to do this, or that we're supporting as much as we can with funds to do so. Then we want to focus on really working with local governments to appropriate or reallocate funds to address solutions and invest in communities that need the most support. So analyzing, and we definitely can do this with you, like looking at your local government budgets to really identify opportunities for existing funds to support implementation of safe routes to parks. Solutions in neighborhoods that need the most support. For example, we can, work with local law enforcement agencies to refocus officers' times to participate in some community events to build relationships with neighborhood residents. And if you remember from the group orientation, we mentioned that working on that relationship between community and law enforcement is a strategy to help with personal danger, for folks, accessing the park. So that is a way that you can, look at what you have in the budget and kind of see how else, you can work with what you have with the budget. So I'm going to, and then lastly, building capacity of residents to advocate for desired changes, making sure that, you're providing some type of training or just some types of support, just being, going with the residents and being there as they testify at council meetings for these desired changes that they've already see as a need through the assessment process. So for an example of this, this was the Minneapolis Parks and Recreation Board, and in there they had a 2016 annual budget. They utilized an equity matrix to select capital improvement projects in neighborhood parks and trails. And so in 2017, the board expanded on this, and they created a second matrix for selecting regional parks improvement projects. And this matrix really is designed to evaluate their regional parks and trails to ensure that public money is allocated to those community spaces that have historically received lower levels of investment, where funding would bring significant benefits to the park users. So the equity criteria ranks community and park asset characteristics as the basis for prioritizing these investments. So the park characteristics include historic investment, use intensity, ADA considerations, natural resources, and trail quality. And investment priority is really most crucial in areas where overall community need is greatest. And so therefore the board, in this case, they place more of a higher collective or total point value on the community characteristics, which includes racially concentrated areas of poverty, park access, and neighborhood safety. And so in addition to doing this, their budget process now requires that each new request or potential budget can cut be viewed through an equity lens. So just another way of, as you're planning, looking at your budgets, that you can incorporate equity. There are a lot of examples. And if anyone's interested, I can definitely share that, the equity matrix. Okay, number 4 out of 5. So incorporating equity into implementation. So this is, we're getting ready for that, and we'll do Landis. So when we're getting ready to put what we said as our solutions to getting to our the priorities that we saw from our assessment, now we're getting ready to put this in action. And again, we're going to always start off with involving your residents, including youth, in implementation activities. You can invite law enforcement members to attend a series of forums and or community events to discuss conflicts and build more trusting relationships, and then collaborate on ways to improve safety in and around the park with residents. You could also design wayfinding and park signage. So you can invite community residents to really share their visions, design the art, or even select the color schemes that best reflect the character of the neighborhood. So there are a variety of ways, but whatever you're doing, please make sure that you're engaging your residents in doing so. That also helps to, like we mentioned before, build ownership. So also making sure to schedule implementation activities during times that work for community residents. If that's on the weekend or in the evening, it just depends. We know certain things can't happen too late, but if that's the case, maybe you want to think about doing that on the weekend. Conducting activation activities to engage residents in the change. You want to host events that are culturally relevant, that are also co-developed and co-designed by the community, and involved community groups in showcasing the improvements to park access. So use the assets that you have in your community. I mean, it actually makes it easier for you to not have to really think about planning anything to activate these spaces. And you're able to really lift up those that live within the community, those that work and really work for the community. So also making sure, like we mentioned before, building capacity of community residents to really hold elected officials accountable for what they agreed on from the past stage. We want to ask residents, how comfortable do they feel with meeting with local government leaders to really advocate for these changes that they were promised. So building their capacity to reach out to their elected officials and government agencies, whether via phone, in person, or at council meetings. And then also considering or helping them to consider and addressing the obstacles that may prevent some of these residents from actually pursuing these opportunities. So making sure we address those as well. So if it's helping them with transportation to get to these locations, thinking about immigration status that may stop someone from participating, offering childcare or translation and signing opportunities. All right, so now we want to evaluate the impact of the changed environment on people of color, low-income communities, and other marginalized populations. So at this point, we've done the particular activity, but make sure before we have that
another mass casualty.
We understand. I'm sorry, someone is talking.
Oh, sorry, I think that was me, Danielle.
That's okay, Kenyon. Thank you. So just making sure that you can really, you have a baseline data of what it is that you're looking at, and then you're measuring it after and seeing the impact. So, identifying a list of metrics and the data collection process that you want to use. So collecting quantitative and more qualitative data, which is more like lived experiences, to better understand the impact of that changed physical or social environment on people of color, low-income communities, and other marginalized populations. So you can conduct park observations to count how many people are walking to or within the park compared to baseline. You can hold conversations with community leaders, park neighbors, businesses that are near the park, and ask them about how the improvement is affecting their perception of safety now of the surrounding area. And then you're able to really use that data to inform next steps in implementation, including course correcting if the implemented change isn't benefiting the communities that you really want it to. And so an example here comes from, we had pilot sites that we worked with, so not last year, but the year before, where we just offered them technical assistance. And so this was New Bedford, Massachusetts, the Department of Parks, Recreation, and Beaches. And so they had conducted a variety of assessments to identify areas of improvement to access one of their local parks. And so they found that there was a need for like minor sidewalk repairs, better pavement markings, and increased signage. And so in May, I think this is May last year, they partnered with Walk Boston, Mass in Motion, New Bedford, their planning department, Department of Public Infrastructure, and neighboring schools to temporarily install a parklet and then a brightly colored crosswalk to help slow traffic at an intersection during where there's heavy traffic after school dismissal. And so students were involved from the neighboring schools. They helped to color the sidewalks and parklet with chalk. And then on that specific day, they had games and activities for the youth. And then they also had an on-site survey for attendees to provide feedback about that temporary street installation. And they actually noted that the efforts really did help slow the traffic, and it caused no difficulties for the school buses and delivery trucks that were maneuvering around those bulb outs that you may or may not know about. I don't know how to describe it. It's like something that stands up and kind of allows folks not to come in a certain area. So because of this, the agency created a permanent change, shortening the crosswalk distance for pedestrians crossing the street. So this is just another example of involving residents, and they involved youth from the schools that are around. So many of you have parks that have schools that are nearby. So that's a prime opportunity to involve youth. And I mean, it's always, I say fun loosely, working with youth in these opportunities. And so it's a great way to get things kicked off and get some more support and more buy-in from the public, and then hopefully even elected officials for more funding to support more permanent change. All right, so now for our last section. Okay, so this is sustainability. We want to make sure that all the hard work that you all are going to do this year, because there's going to be so much engagement of residents and other partners on your coalition and in the broader community. We want to make sure that you are continuing to build on those authentic relationships that are being developed here and support reciprocal activities. So continue to really stay abreast of and participate in, or really assist with activities and initiatives of your partner coalition members. That is so key. This really helps to nurture the relationships that you've developed and show support, and makes it easier to identify ways to align for future opportunities. If you're staying in contact, you guys will always really know how you can help each other. And that helps to build trust. And like we said, over time, building trust can form really authentic relationships. Then offering residents, especially youth, opportunities to become champions for this work and contribute their ideas and time. So, through this, like one of our pilot sites from Pittsburgh, Pennsylvania, they developed a Friends of August Wilson Park, where they're going to have elected officials and partners that will continue the work that they started through Safe Routes to Parks. So that's really helpful. That's a way that you can engage residents going forward. You also want to find or develop opportunities for community members to serve as advisory committee members or governing board members for the project, or to the local government that's responsible for really implementing the plan that you all will be producing. And then as much as possible, please compensate residents for their time contributing to their efforts. And you can do that in a multitude of ways. Again, continuing to build capacity of residents and partners. We want to make sure that you're identifying the training and skill building needs of the residents, and then pairing that with opportunities for them to learn and grow. So that could be through an equity training. It could be through like the leadership development programs I've been mentioning that you may want to offer for them. And even if you can't do it as your own organization, I'm sure there might be a local grassroots organization. And if that's something you want to look into, we can talk about that on our calls. Like, how can we, find a local organization that really helps with leadership development to help with our residents and building their capacity to do this work. Or even like advocacy and organizing workshops, just anything to really put the ownership in the hands of the residents. And then remembering to account for obstacles that may prevent them from participating, like we mentioned before. Monitoring who is and isn't using or benefiting the implemented change. So like we mentioned before, continuing to collect the data after the implemented change. And course correct as needed. You want to make sure that the changes are positively impacting the community. And be sure to ask residents about their perceptions of the changes. And then, you'll have this data that it could really be useful for future projects to increase investment into your Safe Routes to Park efforts, and then other learning opportunities. And then lastly, examining the budget to ensure funds are being used to address community-specific needs of communities that need the most support. So evaluating your community parks and recreation and transportation budgets, seeking opportunities to really influence the budget process, if possible, to include the priorities that you have found through the work that you've been doing or will be doing. If this involves redirecting funds, make sure that you consider the unintentional impact on other aspects of the community's health and well-being. We don't want to take from one area and make it worse to help our area. That's not what we want to do. So always, every step that we take, always looking back and assessing, how do we think this is going to affect the community? And then after the change, making sure that we still go back and do that, because we may not get it all. Also identifying other sources of funding and consider how these new revenue sources could also adversely impact individuals and communities. That's something to think about as well. And then just the last example, Monte Sano Park, this was the Recreation and Park Commission for the parish of East Baton Rouge in Louisiana. So they were making the case that, the Safe Routes to Parks really benefits various agencies, which it really does. You want to make this mutually benefit. This is not only for your nonprofits, it's not only residents, it really can benefit the work of transportation folks, public health, it's just like every sector. And so they were able to make that case, and they did a lot of work doing work with their planning and engineering departments, where they're working with that planning and engineering department is working with a consultant now on designing a bike and pedestrian trail that will connect to the park. They also are working with the conservation department on hosting some cleanup days around the park as well. And so because they saw that there was so much support and how Safe Routes to Parks really does help out other other sectors and other, departments as well, that they were able to get $8,000 added to their regular operating budget for last year, 2018, because this was in 2017 when they started. And that was specifically dedicated to projects related to improving safe and equitable access to parks in low-income communities of color. So again, we can be very specific about our language because we are paying particular attention to communities that really have been left behind, and how much more we can put more support there so that we are reducing the disparities that exist. All right, so that is actually all that I had to say, which was a lot. I know it's a lot of information. I wanted to see if there are any questions that I can answer, or that someone else can answer on this phone, because you all, I'm sure, have done some of this or worked with some of these. Are there any challenges that anyone wants to share, or lessons learned or ahas around working on trying to address equity? Just any general questions about this work related to Safe Routes to Parks. And remember, you might be on mute. And we do have, if you look on our webpage, the Safe House of Parks webpage, I'm not sure if this was already shared in the chat box, but if it wasn't, I didn't remember that I could have added this, that we have some resources. We developed 5 different resources, very brief fact sheets on incorporating equity into each one of the phases. So they have action steps and then like how you can work on it. A lot of the stuff that you've heard today, but that information can be reviewed and or shared with partners too. Thanks, Marisa. So yeah, so that would be a good step to look at as well. And remember, there really are no experts. It's just taking action. It's seeing that this is unfair, it's unjust, and what can we do to move this work forward? And again, it not only addresses that, but it creates more ownership when we're working towards more equitable access, when we're looking at our power, when we're trying to say, okay, we're going to release this amount of power and really engage residents and work with them. And this is where we're at now, and maybe we'll move further along. But yeah, it's a huge task. It's not easy. So we'll be definitely working with you all throughout our one-on-one calls, and then when we come in person to make sure that we're always thinking about how is this affecting the population that we're serving. Any other questions? And I know I'll get back to you all with the questions asked, or the question that was asked before. Yeah, and if there are any other questions that come up along the way, feel free to ask us during the calls, phone us at any time, send us an email. And then remember, we will definitely get this presentation to you, the recording as well as the PowerPoint slides. All right, so thank you so much. If you have any more questions, feel free to stay on. If not, you have gained back about 15 minutes of your day. So I hope you have a good rest of the day.
Thank you, Danielle.
Thank you.